lecturer, Dr. Kwadwo Ameyaw Korsah. Over the second semester, I've been taking you through conditions of the integumentary system, medical conditions of the gastro-intestinal system, and the medical conditions of the endocrine system. These systems were studied with special attention to their definitions, types of conditions associated with these systems, their prevalence, risks, etiology, pathophysiology, clinical manifestations, diagnostic investigations, differential diagnosis, as well as management of medical conditions under the various systems that I have just mentioned. We also take into consideration special care that are needed for patients suffering from these particular conditions that we have mentioned under the three major systems. It is also very important, as part of our course, we identified various frameworks under which we use to manage patients with these particular conditions. Particular reference is made to Betty Newman's prevention levels of intervention, including primary intervention, secondary intervention, and tertiary intervention. In addition, Virginia Henderson's nursing components were also considered, which were very important for the care of patients suffering these conditions. Specifically, taking into consideration conditions associated with the integumentary system, we look at inflammatory conditions of the skin and its appendages, including parasitic infections, fungal infections, bacterial infections. Specifically under bacterial infections, we talk about cellulitis, which is a very big condition that affects patients. We also look at viral infections and the allergic reaction of the skin, including lupus erythematosus, and then papillomastoid diseases, including psoriasis and then acne. These were some of the conditions that we studied under the integumentary system. I also need to take this time to interact with you and discuss with you conditions that were associated with the intestinal system. We looked specifically at conditions of the mouth, for instance, stomatitis, gingivitis, thrush, and then recent angina. Esophageal diseases, including gastroesophageal reflux disease, GERD, was also studied under the esophageal conditions. Medical conditions associated with the stomach were also studied, including gastritis. We look at etiology, definition, clinical manifestations associated with gastritis, gastric ulcer. We look at the definition, clinical manifestations, treatment, and then prognosis to these conditions. In addition, we looked at disease of the ileum, including enteritis, malabsorption syndrome, duodenal ulcers, the colitis, and then typhoid fever. I want to take this particular time to inform you that typhoid fever is a major condition affecting Ghanaians, and so we took a lot of time to study it. We look at the definition, we look at the causes of typhoid fever. In some cases, they call it enteric fever. We look at the management, including nursing management, medical management. I was particularly worried about how people go about stooling, which was a very important factor that we look at, especially how people attend to their personal hygiene. And of course, we know that typhoid fever is one of the major conditions affecting people because of poor hygiene we have in Ghana. If you travel to the lorry stations, you can imagine, you can bear with me, that we don't have toilet facilities and the people do their own things everywhere. And so in rainy season, this is a major problem that Ghanaians face. And so it's very important that we study this kind of condition. As part of the conditions associated with the gastro-intestinal system, we also looked at the rectal or colonic diseases, including enema colitis, ulcerative colitis. Of course, animal colitis is a very big problem also associated with Ghanaians, especially our mothers and their children. You know, when the child is born and the child is not passing stool, for the first probably 2 or 3 years, the mothers are fond of giving enema to children because they are not passing stools, and these have clinical repercussions on these children. Some of them are not able to pass stools after giving the enema, and so they have distended abdomen, they have sepsis and the rest. And so this is a very important area that also needs to be taken into consideration. As part of the GIT, disease of the accessory organs of the digestion, we talk about hepatitis, we look at the cirrhosis of the liver, hepatic coma, cholecystitis, and then pancreatitis. These were also looked at with particular reference to some of them, including hepatitis, cirrhosis of the liver, and then the pancreatitis. These were some of the major conditions that I want you to highlight in your preparation towards your exams. And with particular reference to typhoid fever, I think it's very important that we need to consider that as one major area that is likely to appear in you. I'm not saying that the rest are not coming. You need to prepare around all these things. Now let us look at diseases and the abnormalities of the endocrine system. We have already looked at the disorders or diseases associated with the pituitary gland. We look at the hyperpituitarism, hypopituitarism, diabetes insipidus. We have diseases of the thyroid gland. We look specifically at the hyperthyroidism, hypothyroidism. Disease of the parathyroid gland. I think that one was given to you as a reading assignment, which I think you have gone through that, and there will be no problem for you during your examination in case it appears. We have also disease of the adrenal gland, including Cushing's syndrome, Addison's syndrome. These are the major ones that I gave you notes on, and the rest I asked you to read. And then we also have disorders of the pancreas, with particular reference to diabetes mellitus, which is a big problem facing Ghanaians because of our lifestyle. And that point, we took a lot of time to look at it, including type 1 diabetes, type 2, and then gestational, with particular reference to type 2 because of our lifestyle. These are some of the major conditions that we studied under the pancreas. I'm happy to tell you that it's likely that we may get a major question under diabetes mellitus, especially type 1 and then type 2. Of course, I may be asking you to give us information about the causes, how they are managed, including nursing management and then the medical management, as well as other things that are needed in the management of patients, especially how they cope. Some of them have negative coping skills. Some of them have positive coping strategies, and we need to take all these things into consideration in their care. Some of them have different beliefs, misconceptions about the causes of the condition. We need to take all these things into their care. It's not only about giving them medication, but we need to take into consideration their experiences, we need to take into consideration their reaction, we need to take into consideration their cultural background. These are all important in the care of patients suffering these non-communicable diseases, especially those that I have just mentioned. And of course, not the last, but also needs to be mentioned, disorders associated with the gonads. This, I gave you some notes on them, and then at the same time, I asked you to read some components of those conditions. So basically, under the NES 232 medical conditions of the integumentary system, gastro-intestinal system, and then the endocrine, these were the major areas that we studied. And we have recommended textbooks that we asked you to go through. And then I think if you have done those assignments, I don't think you have any problem at the end of the course when you are supposed to do your exams. Now, let me take a few minutes to interact with you and then discuss with you the exam structure for NES 232. There will be two major sessions. Session A will comprise of about 50 multiple choice questions with answers A to D. And you have to choose the right answer from A to D. That is session A, multiple choice, A to D. Of course, I may not be able to tell you some of these questions because of the nature of the university examination. We just give you the structure. And then the session B, if you are with me, we know that we look at three major systems: integumentary system, gastro-intestinal, and then the endocrine system. So what I'm going to do is that for session B, I will give you three major questions covering these major areas: integumentary, gastro-intestinal, as well as the endocrine. So three major questions will come from these areas. And then the session A, which I've already informed you about, it will cover all the areas that under the three major systems, but the answers are there. But the session B, the three major, which is the essays for gastro-intestinal, and then the other one coming from endocrine. But of course, those areas that I've already mentioned, I pointed to you that some major ones, for instance, we talk about diabetes, we talk about typhoid fever, and then we talk about cellulitis, of course, coming from bacterial condition. These are the probably major areas that you need to consider when you are preparing for the session B. Of course, things may change, so you don't need to actually rely on that as a matter of fact. So, I wish you good luck in your exams. Thank you very much.